There is one organ which causes high blood pressure, and it's not what you think. And there are specific exercises you can use to target and fix your blood pressure easily. No diet, lifestyle changes, or medication required. Check the link in the description below, but for now, today's question.
The question, is mild pulmonary hypertension fatal? I am not a doctor, but I do have pulmonary hypertension caused by sleep apnea. I now use a CPAP and are on supplemental oxygen temporarily. I also am overweight and live at an elevation of over 6,000 feet above sea level. Of course, your question is really best asked to your doctor, and if you have pulmonary hypertension at all, you should be seeing a lung doctor, pulmonologist, and a heart doctor, cardiologist, regularly at least. They will probably want you to undergo various tests to determine your level and needs. So how do you know you have pulmonary hypertension or that it is mild? What do you consider mild? Actually being on supplemental oxygen or just needing to catch your breath when you run up a flight of stairs? Untreated moderate pulmonary hypertension usually results in 1 out of 3 people having it dying within a year, and the odds get worse over time. This is because the disease is progressive and can advance quickly, as well as most the time it is caused by a serious primary disease or unknown. However, if the underlying cause of your pulmonary hypertension is reversible and is properly reversed and treated, a person can have a normal lifespan. Also, if it is caught and treated early, even if it can't be cured, a person can live pretty normally and comfortably. Since the cause of pulmonary hypertension for me was undiagnosed sleep apnea, the main things to do were to treat the sleep apnea and provide supplemental oxygen until I could recover. I had to have a sleep study and other tests of my heart and lungs, then was given a CPAP to use when I sleep, a home oxygen concentrator and a portal oxygen concentrator. I had difficulty using the CPAP consistently due to nasal congestion, but I have just starting using a full mask. I am losing weight and getting stronger, and I don't need supplemental oxygen now when I am sitting. I use it only when walking. I've had PH for almost 2 years, diagnosed, probably for several years before that at least. I ended up hospitalized as it really snuck up on me over time, and my primary care doctor never tested my oxygen despite multiple visits. I expect to be off supplemental oxygen soon, but it is slow progress. I live at an elevation above 6,100 feet, so I would probably do much better to move to a lower elevation, but I have a house, family, friends, and a job here, so I'm staying as long as I can still get better here. So to answer your question, pulmonary hypertension is fatal if it is untreated. Even mild pulmonary hypertension is likely to progress unless it is treated and the underlying cause is resolved. Years ago, before there was treatment for pulmonary hypertension, it was common to see people deteriorate and about 1 out of 3 people would die in the course of an hour. So in 3 years it would be likely that all 3 people suffering from pulmonary hypertension would pass away from it. Of course, there are levels of pulmonary hypertension, and nowadays there is treatment as well as diagnosis to the underlying causes of pulmonary hypertension, and if that can be resolved, pulmonary hypertension can usually be reversed. So I suggest you talk to your doctor ASAP, and he or she will likely send you to a specialist and out for some tests to determine the progress, your needs, and what the underlying cause and treatment should be. I hope that helps. If you need more answers and advice on hypertension, I've included some links in the description.